two important things here. We are terrified about sepsis in the NICU. Babies have a weaker immune system in every possible way. Their barriers to the outside world, so their skin, their gut, and their lungs, are much weaker than in an older patient, so much more likely to let bacteria and other bugs in. Also, their innate and their adaptive immunity is also a lot weaker. So it is much easier for a baby to actually get an infection. And when that baby gets an infection, it's much more likely to travel around the body. So for example, if you have a cellulitis or a skin infection or an umbilical infection, it's much more likely to go into the blood, cause a bacteremia, and even cause a meningitis. So two important things here. The first one is we have to be extra careful that we are not giving the babies an infection. And the most important thing that you could do is make sure that your hands stay very clean. So we're always scrubbing our hands at the beginning of a shift, cleaning them before we touch the babies. But also, just as importantly, we want to recognize if a baby has an infection very early on. So if a baby's acting sleepier or more lethargic or just isn't moving as much, or if there are like physical signs, you see redness around the umbilicus or there's green phlegm coming out of the trachea, then all of those things should alert us to think, okay, we probably need to start antibiotics before this gets a lot worse.